Hi everyone, this is Kate Warnock coming to you from the Guidewell UST Global Innovation Center here in Lake Nona. I am delighted to bring today to our Insights Lounge Dr. Rich Wender. Dr. Wender, welcome to the interview.
Thrilled to be here, thanks.
So Dr. Wender, of course, is the Chief Cancer Control Officer for the American Cancer Society. So my first question for you, Dr. Wender, is this. Why is it that the American Cancer Society chose to be the presenting sponsor for our immersion event, Greater Than Cancer?
Well, in a way, it was a pretty easy decision because we've long recognized that the challenges in providing good cancer care cannot be solved by any one organization, by any one entity, by any one sector. It really is an all-hands-on-deck type of problem. The other thing we've recognized is that innovation and change are the key to making real difference. We've actually are pretty darn aware of what the barriers are, what the obstacles are, what's not working. The real challenge is, can we harness some of the amazing technology, but also human compassion in the organizations and the people who are here to blend all of that wisdom, all of that brilliant thinking together to come up with something new that really gets at the root, at the heart of the cancer problem.
I know that on behalf of Guidewell, we are delighted to have the American Cancer Society as our presenting sponsor. And you were moderating a panel today that had many of the experts from ACS, and one of them said something that was so, I think she just painted such a visual. She said, being a cancer patient is like someone who has to assemble a 1,000-piece puzzle without knowing what the picture looks like. What role is ACS playing in helping someone who might be newly diagnosed or further down their journey with cancer make sense of all of these puzzle pieces?
I agree with you. I thought it was a brilliant analogy and all too true. But just think about it. When you hear that you have cancer, your mind turns off. That's all you hear. And it's so many people today, even today, despite the progress we've made, hear the word cancer and immediately their mind goes to, my life is threatened. Mm-hmm. My life could even be over. So it's not shocking that people's thinking processes slow down. They just become focused and narrow on that one question. Then they have to face the challenge of this totally new, complex journey, which they couldn't have even envisioned just the day before, right? Because that was not something they expected to hear. As so many cancer patients said, it rocked my world in a way I could have never imagined. It shook me out of a safe place into a very unsafe and very scary place. So here's the challenge. We cannot expect people to be their own navigators, to figure out the steps that they need to take to get through this. We need to help them keep things pretty simple, to take things day by day, and I'm going to talk about that as this conference goes on. That means that all of us, and it's not just the American Cancer Society, all of us need to combine to provide the safe haven, to provide the information, to provide the guidance, the navigation that anticipates the barriers that a particular patient is going to experience and provide some suggested solutions before the patient ever faces them. We're working with some brilliantly innovative companies now who've that's exactly what they're tackling. They're trying to gather the wisdom through crowdsourcing of people who've been through this experience to say, what did you have to know at every point in the journey? And a patient just has to log on and say, okay, you're about to go to your first oncology visit. Here's what you should do. Here's what you should know. Here are some things we are specifically doing. We have the largest cancer information center in the world, the National Cancer Information Center. They're all located in Austin, Texas, which that's a best kept secret, used to be, that everybody's in Austin, Texas. An amazing group of 500 people, including cancer information specialists, including oncology nurses, all trained to answer people's questions and to anticipate their needs. And I love listening in on some of these interactions that our cancer information specialists do because they're so good at gently helping people get in touch with their real questions, their real needs. And of course, it's informed by the largest cancer website there is in the world, the American Cancer Society website, right, with an equivalent of 20,000 pages worth of information on every cancer. So by being that source of information, and patients view it as trustworthy and objective, And of course, we strive to be just that.
Sure.
That's just a gentle and wonderful way to help people take that next step and to get the information they're ready for and to move forward. It's not all we're doing. We have a staff of 600 individuals scattered all over the country in many communities in every state who are working with primary care health systems, with hospital health systems, and with insurers, payers, quality improvement organizations, including a very robust partnership with the Commission on Cancer, which accredits cancer centers to help all of these facilities meet the standards of care, including everything from diagnosis all the way through survivorship, palliative care, end of life. So there are secret sauce. These 600 people who are out there in real partnerships, they're really what make the difference. The more local you can make this, the better it is. 100 of those 600 are navigators who work in hospitals. And those 100 navigators, for the people who really are facing the biggest barriers to care, make a huge difference. And the final thing I'll say is that part of the National Cancer Information Center is that we have a resource manual, online manual, of thousands of resources, including resources tied to your community to help people deal with transportation, with lodging, with financial barriers, with information needs, with social needs. I said finally, I lied. The only other thing I'll mention is we then directly offer services such as our Road to Recovery program, where we actually give volunteers, help people get to their treatments, and our lodging program, both through hotels and our own amazing Hope Lodge program, 32 Hope Lodges scattered around the country where patients in need of complex care stay for free.
You know, Dr. Wender, listening to just how rich the resources are that American Cancer Society provides, what strikes me is that you, at what can be the scariest moment of someone's lives and their families, you're there for them every step of the way, and you're providing the information for them in the way that they need it, whether it's a search through your wonderful archives of content, whether it's putting them in touch with someone that could meet with them locally, or even a support group online. You know, so many different ways that you're providing that outreach. And I think that so many of the conversations I've had with folks that we've been interviewing, it's about that human element. And it so seems that ACS is so well positioned to really deliver that humanity in the cancer journey.
Well, thanks for saying that. And it's something that's in our hearts, and it's something we strive to do every day. But I'll tell you the truth, Kate, we're still only scratching the surface of the total need. There is no one organization that will ever have the resources to do this alone. This is all about partnership. And again, going back to your very first question, that's why we're here. It's to join with these other amazing organizations who share our commitment and our passion for improving the experience that cancer patients and their caregivers face. So we're honored, thrilled, humbled to do our part to do it, and we're dedicated to doing even more, believe me. This problem is far from over, and we're going to keep working. But we're also equally excited about joining with GuideWell to create a type of dialogue that doesn't stop tomorrow, but really keeps going beyond the end of this conference.
Well, you know, Dr. Wender, one thing that you mentioned earlier during your panel was you are yourself by training a family physician. And, talking about someone who is directly involved with the patient, do you think that family practice physicians can be doing more? Can they have a greater role in the cancer care experience?
Well, the answer is undoubtedly yes, but let me put some details on that. First of all, primary care clinicians are already having a profound impact on the landscape of cancer here and around the world, because our greatest reduction in mortality has been through prevention and early detection. And it's the primary care clinician who is chiefly responsible for giving that recommendation and facilitating those interventions. So we're partnering with federally qualified health centers and primary care organizations all around the country to increase screening rates, to promote HPV vaccination, to promote tobacco cessation. And so they're already profoundly involved in changing the face of cancer in the United States. I think the next horizon and the next kind of mountain to climb over is what happens after a patient is diagnosed. And there's a lot of people who've said, eventually these longer term survivors will be back in the care of their primary care clinicians. And I've had the chance to be a part of these dialogues, to write about it. And I think we would all admit most primary care clinicians today are not prepared. They do not have the tools. They do not have the seamless communication to really coordinate to the extent that is needed the full survivorship care plans, which we and others have written guidelines about. So I think one of the opportunities coming out of this conference is to catalyze a ongoing dialogue with leaders in primary care, and I was so thrilled that we had family physicians at this conference to figure out the right models that allow a much more seamless transition in care and greater involvement in primary care. But this I will say, just saying to primary care clinicians alone, you need to do it better, you need to be more involved, that is not going to be useful.
Right.
We need to come together, really listen to the barriers that primary care clinicians face, and come up with some shared solutions.
Dr. Wender, given that response, I wonder if that is going to be the answer to the question that I'm about to pose to you is, what do you see as the greatest opportunity to improve the cancer patient experience? Is it that transition and that enabling the family practice provider to have everything that they need to help that journey continue, or do you have a different opinion?
I think about this a lot. If you only had one intervention, what would it be?
What would it be?
And actually, I would not say it is just care coordination. I actually think the answer is more fundamental. Right now, we have a fragmented and unequal system. And if I were to just pick one, it would be a shared commitment of every healthcare institution to creating equity. Equity in healthcare just means giving everyone a fair shot, a reasonable shot to get access to the basic care that they need. It doesn't mean in a complex society like the United States, that doesn't mean absolutely equal care. People with greater education, greater resources will have more opportunity to purchase different levels of care, to travel, will have perhaps greater access to complex information, but everyone should have access to evidence-based, proven care, from prevention through screening, through diagnosis, through the initiation of treatment, through a reasonable amount of treatment, through good end-of-life care. If you only give me one, and there's a lot of things I'd like to improve, it would be a shared commitment to equity, to dealing with both the policies and the actual institution by institution, organization by organization commitment that everyone has a fair chance to have as good an outcome from their cancer diagnosis as possible.
That certainly seems very fair to me. So, all right, Dr. Rich Wender, thank you so much for spending your time with us, sharing your insights with us here at the Guidewell Insights Lounge. My name is Kate Warnock. Thank you so much for watching.